Good afternoon, everyone. I'm Rick Barron, the Executive Vice Chancellor for Health Affairs and Dean of the School of Medicine and the Executive Director of the NextGen Precision Health Initiative. So thank you for joining today's NextGen Precision Health Discovery Series. This is a big day because it's the first time we've been able to have the NextGen Discovery Series in person. So I know the majority of you are still on Zoom land, so thank you for joining. So it's a pleasure to introduce today's speaker, Dr. Kale Monk. Dr. Monk is an assistant professor in the Department of Human Development and Family Sciences in the College of Education and Human Development, and a state specialist for Youth and Families Extension. His research interests include relationship and quality and stability and the relational dynamics and mental health of military and veterans couples, which I'm very interested in as a veteran. So I've asked Dr. Monk to share research on how social relationships are a critical aspect of development and how social isolation and loneliness are significant predictors of premature death. These factors have stronger effects on longevity than more traditionally recognized health determinants like hypertension or heart disease. Therefore, the way I see it, identifying individuals who have the loneliness risk factor is essentially identifying a precision health variable that needs to be addressed in their care. So with that, I'm going to turn it over to Dr. Monk. Welcome, Kale.
Thank you. So I want to thank everyone for making the trek over here in the heat, and thank you all in Zoom land for also tuning in. I know I got pretty burnt out on all these Zoom talks, so I really appreciate that, and we'll try to make it engaging for you all too. I'm told that you'll be able to use the chat, and I do have a few engagement type questions because this is one of my first presentations back in 2 years too. So I want to take advantage of that engagement. I'm going to try and remember to stay between these two banners so that you can see me on camera. So like my introduction implied, I'm an assistant professor in the Department of Human Development and Family Science, and I'm going to be talking a bit about loneliness in your health. And typically when people think about loneliness, they're thinking about people who are socially isolated, but I'm going to talk a little bit about how those terms aren't synonymous, because you can be surrounded by people and still be lonely, right? And I focus more on loneliness among people who are coupled, who are in a relationship. So looking at variables like relationship quality as a precision health variable. So I first want to just give you a little bit of background about myself. So I received 2 degrees from Kansas State University, and when I mention Kansas, I usually get a lot of boos, but people find out I'm not from KU, and so they excuse it, right? But I did my master's in couple and family therapy, and I worked as a therapist for about 3 years. And even when I was seeing individuals for things like depression or anxiety, I noticed that a lot of what was influencing those symptoms, or what the patients, clients told me was part of the reason why they were experiencing those symptoms, were usually based or rooted in their relationships. Conflict with parents, not getting along with a partner. And so I got really interested in the intimate relationship. And so I specialized in couple therapy and decided to dive into the research and sought my PhD at the University of Illinois. So you can also notice another theme that I've always consistently been at public land-grant institutions. So I'm really passionate about that engagement mission of these universities. So I also have a partial appointment with Extension, delivering education. That's sort of the engagement arm of the land-grant institution mission. And I also put this up here to let you know, I'm not trained as a medical doctor, right? So if it sounds like I'm giving you health advice, promptly ignore it and consult your physician if you're not an MD, or consult yourselves if you are, right? But what I do know quite a bit about is relationships. So I'm a relationship science, and one of the reasons why I'm really excited to present today is because I typically am just presenting to my research to other relationship scientists at conferences, right? And so I don't actually get the opportunity to dive in to why relationships matter, how they affect our health, because we're all in this field. We recognize why it's important, right? And so that's sort of where I want to start today. And so I want you to just be thinking, what is something that you would consider as the most important aspect of your life? Like, what part of your life would you say is the most important? Just think about that for a moment. The most important thing. How many people are thinking about like family? You're thinking about maybe romantic partners, siblings, parents, children, right? And so we understand that relationships are important in that sentimental sense. And I've just recently been immersed in this because I did a review on the impact of relationships on our health, particularly for veterans, because that's a population that when they return home from deployment, they feel oftentimes, or they report feeling that they feel more isolated, a diminished sense of belonging, trouble connecting with other civilians. But the vast majority of the research is on relationships in general. And so again, we understand that relationships are important in this sentimental sense. And one of my favorite anecdotes from a popular press book of a healthcare worker who works in hospice, she was talking to a lot of her patients, and they were talking about their life regrets. And she noticed that a common theme among them was regrets in their relationships. So maybe a fight with a family member that led to estrangement, or wishing that they had spent more time with their family members. So that need to belong, that connection, is something that scientists report is, or believe has evolved, right? So we are much more likely to survive if we're in close-knit communities. We can share resources, we can help ensure our safety, for example. And from birth, we are typically wired to connect with other people. That's how we form our attachment bonds as helpless infants. So it makes sense that loneliness is an important public health risk and an important precision health variable. And we aren't the first to discover this, right? Or the first to think about this. This is talked about in many religions, like it's brought up in the Bible that relationships are important. Ancient Greek and Roman societies practice exile, potentially as a way of circumventing the death penalty, which to me communicates that people see or feel that being cut off from your relationships could be a fate worse than death. And today, many countries are actually talking about or considering banning solitary confinement for a certain amount of days because they see it as cruel punishment. And this demonstrates how social isolation can be so detrimental. And the research, of course, backs this up as well. There's a really popular meta-analysis, so a compilation of hundreds of studies that looked at relationships, depending on how they're measured, social support, there's a variety of measures, as being greater, exerting a greater to or equal effect on our longevity, on our mortality, as other widely accepted public health determinants. So they found that relationships were exerting an influence on our health at rates equal to smoking 15 cigarettes a day, and exerted a greater influence than things like physical activity and environmental pollution. And so you may be asking yourself, what if it's the other way around, right? Like, so people who experience some health condition or a poor quality environment, they may be have less access or less opportunities to those relationships, to that opportunity to connect to other people. And of course we know that's true, but researchers were thinking about this too, and they tested a variety of different variables to potentially explain this. So things like age, sex, initial health status, cause of death, and these effects held even accounting for those variables. And this is pretty alarming because a 2018 survey found that 22% of adults in the US said that they were lonely. So that's a lot of people, right? And if you think about that during the pandemic, those numbers could potentially be even higher now, right? And a similar survey found that the number of friendships people report has been declining over time. And for example, in 2021, 15% of adult men reported having no close friends. And in a UK survey, they found that 75% of general practitioners reported that they saw between 1 and 5 patients each day whose visit was primarily driven by loneliness. That's shocking to me, right? And so I wonder how many healthcare professionals in this room or on Zoom might see similar signs or cases in their practice too. And so you weren't going to get a long-winded social science professor coming here without talking about a few of his favorite studies, right? So we know that relationships affect our well-being, and we can understand how important our family is and our relationships are in the sentimental sense, but they can also affect our physical health. And for those of you who already saw the title and came here, I may be preaching to the choir, you may already know this, but hopefully it's validating and not patronizing, right? So one of my favorite studies, it was actually a series of studies that have been replicated, so there's some variation, but essentially they had individuals come into a lab with an fMRI machine, and they were administered a slight pain stimulus, like a prick or a shock, whenever they saw an X on the screen. So they were primed or conditioned to experience anticipatory stress reaction, a threat response. But when they held hands with a partner, that threat activation, the regions of the brain that were associated with that, were diminished. And what I'm really interested in was their self-reports of pain went from this is painful to this is uncomfortable. And my favorite study was conducted by my colleagues at The Ohio State University. And they brought couples into a lab, and they administered a small lesion, and they followed them over time, and they found that those in more distressed marriages healed 60% more slowly than those in non-distressed relationships. And they looked at things like inflammation. And similar studies have looked at congestive heart failure over the course of 48 months, and they found those in low-quality relationships were more likely to be deceased at the end of the study. So we can see that quality really matters. It's not just the number of relationships that we have. And that's really something that we can glean from this study. And that's why it's really important to understand that loneliness is not synonymous with social isolation. And loneliness is the felt experience that the desired level of social support or belonging does not match your ideal. So we could be surrounded by people, we could be in a romantic relationship and still be lonely. And so that's why I focus a lot of my research on the experiences of dissatisfaction or poor quality relationships and that feeling of instability in our relationships. Because when we partner with people, we often experience what relationship scientists refer as dyadic withdrawal. We tend to spend more time with our romantic partners, less time with friends and family members. And so oftentimes our romantic partner is the only person or one of the few people who are providing us that support. And lower quality relationships are associated with lower life satisfaction, poorer self-esteem, higher risk of hypertension, poorer global health. And of course, like I mentioned before, this association can be bidirectional, right? If we experience a depression diagnosis, those depressive symptoms could lead to impairments in our relationships and vice versa. But a recent meta-analysis here at the University of Missouri actually found that the association is strongest when the health variable is the outcome. And so despite all this evidence that relationship quality or the lack thereof is a critical precision health variable, many government agencies and healthcare funders have been slow to recognize the importance of close relationships as a public health priority. And so given I've talked with many of you, some of you have masters in public health, some of you are physicians. In your work, why do you think that is? Why do you think that funders and other agencies have been slower to recognize loneliness or relationships as an important health variable? Yeah.
It's harder to quantify.
It's harder to quantify. Any other thoughts? And I'm not the only person who's noticing this. Obviously, these scholars notice that, but also the current Surgeon General published a book talking about this very issue, and I can't recommend that enough. But as a relationship scientist, I believe that one of the reasons people aren't recognizing this is because it can be really challenging to identify how does it affect our relationships, right? What are the very mechanisms that influence our relationships impacting our well-being? So again, as many of you are healthcare workers or work with healthcare workers, what would you say are some of those ways that our relationships can impact our health? Again, I'm trying to be engaging, taking advantage of the in-person, but don't feel pressured to share. And if anybody's putting something in the chat, feel free to let me know. What are some ways that you think relationships might impact our health?
Encouragement and support to follow up on your health or seek health care when you're more stubborn.
Perfect, yeah. So encouraging a partner or family member to go to a checkup when that mole looks a little bit funny, right? That is an important way. Other ways.
Mental health on the...
Mental health, yes, that's a big one that we're going to be talking a lot about as an important social determinant of health, or a mechanism in that. And so just to dive into that a little bit more deeply, so based on the research, we obviously know that more people in a relationship, typically, not always, can bring in more income, dual income. This has been one of the reasons why you may have heard of things like the Healthy Marriage Initiatives, which has been controversial in terms of its efficacy, but that is rooted in this idea that if you have more partners, you can amass more finances that could potentially get you more access to better healthcare, right? That obviously isn't always how it works. There's a lot of circumstances that come into play, but that's the general thought. Like somebody just mentioned, we can encourage partners to get a checkup. So I brought up the example of moles, checking on that mole. But here in Missouri, ticks are a huge issue. I know that personally because I just found like 8 ticks on my body just from walking in my yard. And so being able to have someone in your life to spot those, to check those out, encourage you to go get when you're starting to develop a rash or something can be really important. And of course, encouraging partners, parents, to adhere to their medication regimen. So did you take your pills today, right? Or on the flip side, we see, I do some research on intimate partner violence, we can see this is a form of coercion where an abuser may withhold medication. So all important things to check on. And then of course, what we refer to as couples concordance of health. So this is essentially, people sometimes think it as peer pressure. I don't love that word, so peer influence, right? And so there's a very popular book by some famous relationship scientists in my area, Bradbury and Carney, where they talk a lot more about this in detail. But just as a more personal example, my father had quit smoking for 6 months. I was really proud of him. I went back home and he had started smoking again. And I asked you, Dad, why did you quit smoking? You were doing so great. And he said, it was really hard for me to go out in the garage and to see your mom smoking or to smell the cigarette smoke on her. And so I just gave in and started doing it. And we see similar things with diet and exercise. I don't love to run, my wife does. And so there's been times where I've said, wouldn't you rather just stay in and play and watch Netflix, right? And of course, she sometimes gives into that. And so we can be good influences or we can have negative influences on each other's healthcare behavior or health behaviors. Of course, we can provide social support or we can be a source of stress, which gets into somebody who mentioned in the chat about mental health being an important criteria, but it also gives our life purpose and meaning, which was one of the first questions I asked you. The vast majority or all of you raised your hand because you were thinking about the most important thing in your life, being family members. And with veterans specifically, but I think that this can be generalized to other individuals as well. I just know it from a particular article where they found that veterans who are more socially integrated have shorter hospital stays, less likely to get dependent on opioids, and are less likely to be readmitted to hospitals, to a hospital. And this is all potential explanations for why we see that people who are more socially integrated live longer. And so one of the most influential mechanisms that I've focused a lot of my research on is mental health. Because like I said, our partners, our family members can stress us out, can be a source of anxiety, can be a source of depressive symptoms. And so that's where I've focused a lot of my work. And so I'm going to be just talking about a few studies where we have some new data based on the COVID-19 pandemic, because this is a really influential context in order to understand social isolation and loneliness, right? So thinking about those social distancing guidelines, quarantining, and staying at home, all those practices and how that can influence where you get your support and potentially concentrating all that support to just people who are in your home, which can be stressful, right? We're potentially spending more time with family members. I have a lot of colleagues who live alone, which is a whole other stressor, right? A unique stressor. And of course, these are people who are spending more time together. And I recognize a lot of healthcare workers and essential workers didn't have that opportunity. And so that leads to other unique stressors that we need to consider. But the reason why social contact is so important is why a lot of relationship scientists are advocating that we stop using the term social distancing, because it's talking about people staying 6 feet apart to stop the spread of the virus. Instead, talk about it as physical distancing. Just small changes in language can be helpful, because of course we want people to continue to have contact with family members through a variety of mediums, which I'll talk more about towards the end. So I probably don't have to tell a lot of people in this room that the pandemic has been stressful, right? It's led to a lot of uncertainty. It's very novel. So the buzzword of 2020 was unprecedented. I'm so sick of hearing the word unprecedented. I want precedented times again, right? But it goes to show that unless we were around in 1918, not many of us have experienced a global pandemic, right? And with that comes a lot of uncertainties and stressors like concerns about health, loss in general, employment instability, social isolation, disruption in our daily lives and routines, on top of what all else is going on in the world. And so one study found that depressive symptoms had a 3-fold increase in the onset of the COVID-19 pandemic. And of course, we know that poor quality relationships can exacerbate feelings of loneliness, but can also exacerbate those depressive symptoms. So in one study led by one of our wonderful PhD candidates in my lab, we sought to determine how relationship quality impacts depressive symptoms during the pandemic, with the possible explanation of it being via or through this idea of feeling lonely in your relationship. And so we collected data from couples in the US during the pandemic, and the first wave was in May, so right after those stay-at-home orders went into effect around April, and we followed up in September and in November, right around the time of the election. So we also have some variables on the election that we haven't even dove into yet, because we've got so much other data to look at. And so you can see some of the context there about the national unemployment rate. About 65% of the sample were legally married. We had about 8% were identified as being in a same-sex coupleship, and it resulted in around 124 couples. And we had, just for those who are interested, that we had a pretty good sized proportion had experienced 32% of individuals reported at least one adverse effect during the pandemic, like a change in job, being laid off, a demotion at work. And we did have a pretty good sized sample of essential workers as well. And so some of the variables that we were really interested in were just a general variable in terms of relationship quality. So identifying things like, how much did you get on each other's nerves? Let's see, how much did you hassle each other? Did you feel cared for by your partner? So some of those general questions. And of course, we wanted to see how this was associated with relationship loneliness. So I feel lonely in this relationship, and how that all manifested in terms of symptoms of depression using the CESD. And so there were a variety of other measures in our model. So we looked at the potential moderating effect of self-mastery, for example, but just for the sake of time, I'm going to focus on these main effects. And you can see that accounting for depression at time 1, so in that initial phase of the pandemic around May, even accounting for that, we saw that relationship quality was associated with depressive symptoms via this feeling lonely in the relationship. And so poor relationship quality predicted increased depressive symptoms 6 months later, especially via greater feelings of loneliness in the relationship. And so it may be that relationship loneliness may be a salient target for interventions when we're thinking about depressive symptoms and targeting social connection in particular. And so knowing this, knowing that relationships can impact our well-being and can make us feel lonely, I then wanted to understand, why am I hearing from some couples saying, you know what, we've actually relished having all this time together. We're flourishing. We feel a stronger bond. And when I hold back from rolling my eyes at those people, I then got to thinking, well, the majority of people I'm hearing from are talking about how it's really stressful. It's been really taxing on their relationship. Why am I hearing those disparate things as we're spending potentially more time together? Like I mentioned before, essential workers may actually have had less time with family and friends, but by and large, the majority of people are experiencing more time with just those people in their household. And so that creates more opportunities for influence and stress to happen, right? But also more opportunities for support, of course, because we want to be positive as well. And so one of my favorite theories, so I'm a former therapist, and you know us annoying therapists love a good metaphor. And so I love this theory because when it's explained, they often use the metaphor of an airplane, right? And so they describe it as when an airplane encounters a change in air pressure, weather conditions. This would be akin to a transition that alters the climate of a relationship. The partners, i.e. the couple, experience erratic turbulence. The turbulent flight may make passengers question their safety or their confidence and security in that relationship, which may make them reactive and defensive as they start to worry about the loss of life. And in this case, threats to the relationship, the loss of the relationship. Am I going to feel rejection in this relationship or personal hurt? And this parallels the experience of security and meaning in relationships during these critical times of change, right? So you notice themes of uncertainty, but also, if you think about it, I have flight anxiety, so this also really resonates with me. When I'm on the ground, I don't notice things. And again, in our relationships during our day-to-day lives, mundane things may not stick out to us. But when there's been a change, the minute I'm in the air, if that wing starts flapping, I'm going to be asking myself a lot more questions. I'm going to have a lot more uncertainty about that, right? Is it supposed to be doing that? Is it normal that the luggage is making that much noise? Is the engine supposed to sound like that, right? All these things that wouldn't normally bother us during these times of transition might get exacerbated. And so we can also have a lot of influence on our partners in that regard. And one other metaphor that's really similar is a lot of times people will apply this to boats, right? Like, so that turbulent feeling of being on the water. And I really like this metaphor because it fits really well with the pandemic, because people aren't experiencing it in the same way, particularly marginalized communities that have less access to resources, for example. And so this article talked about how we're in the same storm, but we're not in the same boat. And so I really wanted to know why, again, are some couples reporting a really strong bond and enjoying this time, whereas others are struggling, are floundering, flourishing versus floundering. And so using relational turbulence theory as a guide, we wanted to approximate that feeling of relational turbulence. So the amount of conflict in relationships, but also reports of feeling like the relationship was turbulent, feeling like there was some instability. And so we just descriptively wanted to see, how does this map onto data, looking at latent profile analyses. And we found that two profiles were the best approximators to the data. Okay. So you can see here, I'll just acclimate you to this. So again, this includes same-sex couples. So partner one were mostly men, partner two were mostly women. And so you can see in this group, about 73% of the sample was what we referred to as the low felt turbulence profile. And this bottom line, these two bottom lines here, are relationship instability, so feeling like your relationship is unstable. This bottom line here is those reports of instability, feeling like my relationship is in trouble, whereas this top line on both the graphs is more about conflict. How often did you get irritated with each other, annoyed with each other? And so you can see that's consistently higher in both graphs because there's likely more incidents of that. And the greater felt turbulence group, those that are more distressed in their relationships, was about 27% of the sample. And so these groups distinguish between those who felt like the pandemic made their relationship stronger. So around 45% felt like their relationship was stronger. The vast majority of those people were in that lower felt turbulence group, whereas those who felt like it was pretty much the same or got worse were much more likely to be in that greater felt turbulence group. And so the main goal of this study was to identify, do their actual lived experiences in their own words, so the qualitative data, does it map on to these profiles, these clusterings that we identified? And so here's a few questions. There was a lot of open-ended questions in the survey that we asked people, but these provided the most robust responses. And so essentially asking them, in what ways, if any, did the pandemic improve your relationship, and if there was any ways that it hindered their relationship? And so I'm just going to go over the salient themes, and I'll give you a few examples, and then talk about what all this means for precision health. But in that, what we identified as the low felt turbulence group, both of these groups identified this as a stressor, right? So everyone in our sample was talking about how it was stressful, but the people in the lower felt turbulence group talked about it more as a challenge that we were going to overcome together. It was an opportunity is how they appraised that stressor, whereas the other group appraised it as a threat. This pandemic really tested us, and I'm not sure we're going to make it. And of course, there were a lot of general uncertainties in the sample. People were concerned about job loss. People were concerned about health of loved ones. But in the greater felt turbulence group, there was a lot more comments about feeling uncertainty about the future of the relationship itself. So they weren't sure that they were going to make it as a couple. And we saw that way less in the felt turbulence group. And if they did bring it up, it was in the past tense, something that they had worked through. And then, of course, people are stepping on each other's toes, right? During this pandemic, as our routines change, as we experience that turbulence, we're trying to find a new normal. Somebody, you may be used to taking the car at this time, but now all of a sudden your partner has to take it, and that's going to cause some issues, right? And so we're either interfering with our partner's goals and routines for that day, or we're facilitating them. And so everybody experienced this disruption, but the people in the lower felt turbulence group appraised it more as a challenge to navigate together. And they talked about this more in the past tense because they had figured it out. They have sort of developed relatively a new normal. Whereas the other group talked more about it as an irritation. They discovered incompatibilities that they weren't sure that they were going to get past. And then the last thing I'll mention is just this overall appraisal or this orientation towards being a united front against the pandemic. One of my favorite quotes from this was a couple who said it's us against the world, and another couple said we beat COVID. So it's this united mentality. Whereas the other group were more talking about dissimilarity and a mismatch, like this isn't my person. If we were supposed to be together, it wouldn't be this hard, those sorts of things. And so just a few examples so that you can see what this looked like in the data. Ways that the pandemic put stress on the relationship for the greater felt turbulent group. You can see here that they're talking about a fundamental difference in how they handle COVID. So like I mentioned earlier, this is an example of that dissimilarity or interference, that fundamental mismatch that they felt between their partner. And then, of course, people talked about discovering irritations or red flags. These may have been things that they noticed before, but they were really highlighted during this time. Remember back to the airplane metaphor, may not bother us in our everyday lives, but when we're in that turbulent situation, we focus on that a bit more. And of course, also rooted in the theory, people talked a lot more about questioning their relationship, not being sure that they were going to last. And then, of course, that idea of interference, that they're stepping on each other's toes and getting in the way of each other's routines. Now let's contrast that with the lower felt turbulence group. So again, this is about things that put stress. You'll notice here that, again, they're talking about it often in the past tense, something that they've overcome. You can see that they're talking about it as an opportunity to find a new normal rhythm. They're talking about it more in terms of relationship growth beliefs, that this was something that we worked through together. And then, of course, they gave their partners the benefit of the doubt more often. So they were making more positive attributions. You know what? My partner's not a jerk. It's COVID. My partner's stressed, right? And they also recognized their contributions to some of the issues. Like, I was really stressed about the pandemic, and my partner took the blunt of that. Now, this one I feel like is the most interesting, and it's where I'll stop in terms of these data. So this is talking about ways that it benefited the relationship or ways that it might have had a positive impact on them. And so in one group, the lower felt turbulence group, so the group that reported better functioning, they talked about valuing that time together. They saw it as they reframed it as a time or an opportunity to grow. Whereas if you'll notice the greater felt turbulence group, remember, here we're asking them to talk about positives, ways that it benefited their relationships, and they still go negative. So talking about how initially they hated it, it would have been better if we weren't going through something hard at the time. And then it helped us realize that we're just not good at supporting each other. Again, these are positive experiences, and they're talking about it in that way. And so what are all the implications of this particular study? And so we noticed that the pandemic is really an inflection point. A lot of times people thought or speculated that it was going to be universally bad for couples. And of course, it was almost universally stressful. But in terms of the couple relationship itself, it seemed to be an inflection point. If you were doing poorly before the pandemic, there was a lot of stressors, you didn't have good coping mechanisms. The pandemic was going to keep that the same or make it worse in that way, right? Whereas if you were functioning well before, you're able to make more of these relationship enhancing attributions, people tended to do better. So I'll just highlight a few of these implications for the sake of time, the ones that resonated the most. Having more of a team mentality was something that we saw clearly in those qualitative data. So one key difference between these two groups was the attributions that they made about their partner's behaviors. And so, like I mentioned before, that idea of being us against the world, we beat COVID, being a united team against this stressor. And then, of course, this can be most helpful through this idea of boundaries. And when we think of boundaries, we think of things like, I'm going to go to another room and cool off for a minute, which is great and valid. But in our study, that could be really helpful. In our study, it was more about thinking about being intentional with the time that you have with a partner or family members that are more positive. So if you're sitting there stressed about when are we going to have this difficult conversation about visiting your family who's not taking COVID seriously and we have a child who's unvaccinated, I'm really stressed about that, so I can't enjoy my time with you. Instead, I really want to enjoy this time with you. Let's talk about that at 5 o'clock after we're done with this, right? So we're not walking on eggshells, but segmenting those types of conversations and compartmentalizing we saw was pretty helpful among our couples. And of course, like with any study, there are some important considerations. This is longitudinal data, but it's not experimental or randomized clinical trial. Obviously, we can't prescribe one group being in the pandemic and the other group not being in the pandemic. I always describe that because I'm self-conscious talking to medical researchers, but there's not a lot of experiments we can do in our studies randomly assigning somebody to cheat or to break up with their partner, right? And of course, so because of that, we're not able to infer that it was the pandemic that actually caused these things, right? We just know that this is a context in which these things are happening. And so what does all this mean for precision health and for healthcare workers and the general population? This may be pretty hard to see on your screen. This is more just showing you what is in the data that I found, because this isn't just about romantic relationships. That's been the focus of my work, but in terms of all of our relationships in general, this could also be patient-provider relationships. In my work as a former therapist, one of the important indicators of successful outcomes was that therapeutic bond, even beyond the evidence-based model that I used. Does my client feel like they can trust me? Do they feel like they can tell me what's really going on? And research shows that high quality interactions make people more willing to share accurate information, more comfortable disclosing this information, which can be really helpful. So am I listening to them? Am I taking their concerns seriously, and validating those concerns is something that can be really helpful. And so, okay, how do we identify someone who's lonely? One important implication of this work is being able to identify which of our patients, our friends, our family members might be experiencing loneliness. And so John Cacioppo, who was really influential in the area, one of the biggest researchers on loneliness in relationships, advocates for these valid instruments. And so you've probably heard, many of you have probably heard about the UCLA loneliness scale, which is great. A bunch of people use that. They developed a shorter form of that they found has a lot of utility. And so that's something that could be really helpful. And I know that the majority of people that I'm talking to, again, are in the healthcare industry, and many of you are not social workers, not therapists. When I talk to my friends who are medical doctors, that's one of the first things they tell me. However, I do, for example, one of my best friends is a nurse, and she talks to me about how the majority of her job is de-escalating difficult clients. And so this is something that is extremely relevant. And most healthcare professionals are what we would consider people on the front lines, right? You've probably heard that before. As a former therapist, I may not see somebody who's experiencing intimate partner violence unless they get referred. Whereas research has shown that among women who were killed by intimate partner violence, around only 30% had called the police, whereas 41% had visited an ER or a doctor before that happened. So this is really important because healthcare workers can be that change. And I'm really encouraged because a lot of hospitals are already doing this. MU Healthcare has done a really great job. Whenever I go to my appointments, I see the PHQ-9 for depressive symptoms, something that I actually use in my research. They ask questions about feeling safe in your relationship. And so doing a good job with that and thinking about loneliness. And again, you don't have to be a therapist to do some of these things. So like listening with empathy, just showing that you care, educating them on some of the things that we talked about on how relationships are so impactful, because sometimes people will just assume, oh, I'm fighting a lot, but that's not the cause of my problems, right? And maybe it's not. I don't want to act like this is the end all be all, but it can be a contributing factor. And so people may not make these changes right away, and that could be discouraging, but think of it as planting seeds that might grow and flourish, and they might make decisions to change later. And then, of course, providing resources. I'll provide some resources at the end, or even just signs around your clinic that talk about loneliness, intimate partner violence. Research has shown that those things can be really, really effective and create a lot of cultural shifts. And of course, healthcare providers are very busy, and I don't want to put one more stressor on top of all this, right? So having an improving relationship starts at home. It starts with us. So making sure that we take care of ourselves, contending with all of that stress, and continuing on with that airplane metaphor, because I'm an anxious flyer, so that's a metaphor I use a lot. The greatest metaphor of all time, as this image shows, putting on our oxygen mask first. So making sure that we're taking care of ourselves is really important. And so the Surgeon General, I mentioned his book earlier, talks about and gives some advice to, for example, make use of solitude. The first step towards building stronger connections is building that connection with ourselves. So there's a difference between solitude and loneliness. This is a voluntary opportunity to reflect and get connected with ourselves. So some people would do meditation, prayer, going on walks, right? Spending time with the people that we love, not just those in our home, but also making time to check in and call other people can be really beneficial. And then focusing on each other. One of the things that's most consistent in my research about relationship quality is having partners, family members who are responsive, who are listening. So that's where active listening. So putting away some distractions and giving the people in our lives our undivided attention when we can be really helpful. And so just in conclusion, talking about some projects that we're working on now, one is funded through USDA. We know that there's some concurrent pandemics and epidemics going on. So some people coined the term twindemic because there's a lot of increase in opioid use during the COVID-19 pandemic. And so we applied for some funding and got it through USDA to focus on some of these social relationship risk factors. So we focus specifically on youth, providing them life skills, coping skills, but also focusing on some family strengthening programming as well. And then the last project for people who are interested, I have put some flyers back out on the desk if you're interested in getting involved. I heard some participants have already done this. So we have a grant through the Administration for Children and Families led by my colleagues throughout the state of Missouri, where they're offering free relationship education classes. So providing information about knowing yourself, connecting with others, and building healthy relationships. But of course, research shows that the most effective way to combat loneliness is combating some of the social cognitions, because we can learn all these relationship skills and we can have lots of opportunities to connect with people. But if we're still thinking about our relationships in the same way, and going back to that idea of some of those evolutionary psychologists who believe that this was something that was evolutionarily developed, we tend to get more focused on self-preservation when we're lonely because our bodies are thinking we're on our own. We need to be hypervigilant. And so we can be more self-focused and we can think of relationships more negatively. If you're an attachment researcher, attachment person, maybe having an insecure attachment, which can affect the way that we think about things. So one of the best referrals is, of course, individual therapy. Cognitive behavioral therapy tends to be the most effective, but we do have some other programming through extensions. We have a program called Taking Care of You. So I have a link here, and there's a variety of other resources that you might find helpful. And so with that, I will go ahead and conclude it at 47 minutes. I was worried about going over, but that's still 10 minutes for questions. So thank you.
The third slide where you had that work of Renaissance art, what was that trying to demonstrate? Someone that was being cast off and going out of the community in isolation?
Yes, so I couldn't find so there was a lot of paintings on, let's see if I can pull this out. There was a lot of paintings on, actually on exile, but they were oftentimes just people sitting by themselves. And so I found some contradictory stuff that some were not talking about exile, but I thought that it just depicted it well. Yeah. Good question.
Yeah, absolutely. You have a question? Okay.
I could repeat the question. Yeah.
Great talk, thanks. So for the slide that has the data for the lower felt turbulence versus the greater felt turbulence, it looks like you said traditionally it was men and women heterosexual couples. Why do you think on both scales the men had a greater negative feeling?
Good question. Yeah, so that, I don't know if I mentioned it, but yeah, that partner one was majority men. And so let me just go back to that slide real quick, because I think you're talking about, is it this slide that you're talking about? Oh, it's not up there. This one, the one with the charts, yeah. So yes, so partner one, it was actually more so partner twos that were experiencing, they're really close together. We actually didn't see significant differences. In that greater felt turbulence group at the onset of the pandemic, it was actually partner twos, which was 96% women in that sample. And of course, if you remember back to that, that's when a lot of schools were going home. And I mentioned briefly about disparities during this pandemic. We're seeing a lot more women leave the labor force for these reasons, that having to wear multiple hats, having to homeschool their children at the same time. So that was particularly pronounced in those initial months of the pandemic.
And that really leads into this next question from online. How much of the differences in high versus low felt turbulence groups do you think could be explained by attachment styles?
Oh, yeah. So attachment isn't something that we looked at. but we did look at some other variables that might get at more individual differences. And we didn't see a lot of variability there in terms of like indicators of neuroticism, for example, like some of those more personality variables and some other individual difference variables. So we didn't look at attachment specifically. And I would venture to guess that that could play somewhat of a role, right? Like if you have an insecure attachment, you're less likely to trust your partner, that this stressor could certainly exacerbate those experiences.
Right, and then to further go into that, this person was talking about the different subtypes of loneliness: emotional, attachment figures, intimate partners versus social, relating to broader social network or friends. Do you ever differentiate between these types in your work? If so, which form is more detrimental? And if not, do you have a sense of which could be more problematic?
Yes, so I actually love that question. So I'm vastly focused on romantic relationships, like I said before. I think this was part of the question. But so previously, a lot of the comparison data has been on married couples versus single individuals. And for a long time, individuals who are married had better health outcomes. In a lot of work in the demography space, so sociology, they're actually finding in more contemporary cohorts that these data are a little bit mixed. And the reason why there's actually two explanations. That some of it that I reported on was that it matters about the quality of the relationship. So obviously not everybody has a good quality marriage. And so those who experience low marital quality actually have worse outcomes than single individuals. And then those who are in high quality marriages, obviously during that time. But in more contemporary cohorts, that effect isn't as pronounced, or some people aren't finding it at all. And that's because of what I talked about earlier about dyadic withdrawal. There's been an increase in singletons, but they're getting that social support in other ways. So they're spending more time with friends. They have more time to connect with family. And so it's important to not isolate yourself. And one thing that we saw in the qualitative data in our COVID study was that a lot of people, particularly women, because that burden falls on women oftentimes in different sex relationships, which goes back to that prior question, a lot of that burden falls on them to be the one provider of emotional support to their partners. Did I answer the question? I might have missed it.
I believe so.
Okay.
There's a comment that I wanted to share that they wanted to share a resource, The Power of Regret, a book that talks about how looking back moves us forward. I don't know if you'd heard of that.
I have not, but I'll have to check it out because that
Right.
probably
It's
fits
about
with
regrets, and it's from an international study of the types of regrets and how they guide our decision making.
Yeah, I wonder if that's similar to Ware's work, where she was specifically looking at hospice or end of life, but I'll have to check that out.
And then the last two that I have open, which feel free to continue to use that Q&A function and enter your questions in the chat, and those of you in the room. But two people have asked about if the slides would be available.
Yeah.
Okay, so you can get those from me. I'll get those from him. I'll turn it over to Dr. Barron.
All right. Well, thank you very much, Kale, for this great talk. It does bring a different precision health lens onto what we're talking about, the Precision Health Initiative. So thanks a lot.
Thank you for having me.
So as I've said before, these webinars are intended to highlight critical precision health topics and approaches. And we'd like each of you to think about research opportunities in precision health where you can contribute and help identify potential collaborations across the University of Missouri system. So next month, we will have another NextGen Discovery Series, and there's a couple exciting things that we'll be able to announce then. So first, our speaker on that day is Dr. Dennis McCarthy. So Dr. McCarthy's research focuses on cognitive, pharmacologic, personality, and genetic factors that influence risk for alcohol and substance-related problem behavior, with a particular emphasis on driving after use of substances. So Dr. McCarthy is a professor of psychological sciences and the director of the Missouri Center for Addiction Research and Engagement. And this presentation will occur on Thursday, July 14th. And so again, we'll have it in person, and those of you who can come can have box lunches, and the rest of you will see on Zoom. The other thing which I'll be able to talk about at that time, we'll have a formal announcement in the next week or two, is we have finished negotiating with the person who's going to take my job as the NextGen Executive Director. So I'm taking on some new hats and giving off some old hats. We've been searching for the NextGen Executive Director all this year, and we had a national search, and we're going to have a public announcement of that next week. So stay tuned, and we'll actually be able to say a few words about that next month at this forum. So thank you very much, and we'll see you next month.